Hi, I'm David Moliterno from the University of Kentucky and the editor of JACC Cardiovascular Intervention, and I'm delighted to be here today with Ron Waksman from the Washington Heart Center to talk about a very important paper that's coming out in JACC Cardiovascular Interventions. And so Ron, tell us about the specific trial that you've been working on for patients with severe aortic stenosis but at low risk for bad outcome with surgery.
Thank you, David. The low-risk TAVR is the first study that were FDA approved to go into US for patients who are at low risk for mortality who underwent TAVR. The study was 200 patients who were compared to an STS database for 30 days follow-up, and this paper is detailing the one-year outcome of this cohort. The outcome was the following. With respect to all-cause mortality, which was the primary endpoint of the study, it was 3%. The stroke rate was 2.1%, but it was on non-disabling stroke. There was a zero disabling stroke. The pacemaker rate that was 5.5 at the 30 days had additional one case that required a pacemaker. The PVL was one more individual, and we had 1% of endocarditis. But overall, I mean, these results are very remarkable for this cohort. The patients did very well.
Yeah, super exciting, and as you said, the first in the United States. We certainly had earlier data from Notion in Europe, so how do these results match with previous reports?
So what we're seeing when we're comparing these results to the Notion, to the surgical arm, we're doing remarkably well. For example, the Notion one-year mortality was 7.5% all-cause mortality. At the LRTs was 3%. In fact, only 1% was cardiac mortality. So the other 2% were not even cardiac mortality. The stroke rate was much higher. The atrial fibrillation was in the range of 50%. We have about 6% new onset of atrial fibrillation. The pacemaker rate in the Notion surgical arm is the same as what we have in the LRT study. So by all criteria, the LRT data compared to the SAVR arm for the Notion is doing much better.
Well, that's terrific, and again, congratulations on a fantastic study, first in the US.
Thank you, and I think that this study is actually predicting what we're going to see with the other trials. I mean, it's pretty much going to be the teaser for those studies.
Yep, well, we'll know soon.